So, welcome to everyone. Very good evening.
Namaste, sir.
Good evening, sir.
Namaste, namaste.
Namaste, sir. Namaste.
Namaste, sir.
Yes, sir. Good evening.
Namaste. Good evening, sir. Good evening.
Good evening, sir. Namaste,
Very good evening, madam. Namaste.
Pranam, sir.
Pranam, madam.
Namaste, Guruji.
Namaste, sir. Namaste.
Good evening, sir.
Very good evening. Okay. So, welcome everyone to this very important course, that is medical astrology. Okay. So, why this course is very, very important? Because in our life, anything which you lose, we can get back. If you lose the job also, some or other job you can get. And if you lose the money also, some or other way we can recover. But health is something, okay? If you lose it, it is very difficult to get it back. Only the person who has suffered the illness or disease, okay, they will know the real value of wealth. They will say, if health is lost, something is lost. But if wealth is lost, if wealth is lost, something is lost. If health is lost, everything is lost. So like that, we have heard, right? Now in this medical astrology course, what is the intention? Are we replacing the 5.5 years of MBBS or hello, what is that? Siddha, Ayurveda? Not really. They are specialists. They will know the body better than us. There is not even 1% doubt in that. Okay, because specifically for that purpose, they have studied 5.5 years of MBBS, 1 year of internship. Then today, MD or MS is common, 3 years. So almost 10 years they dedicated to study. Then why we are doing this? Because most of the time, the medical or MBBS degrees or whatever it is, you go them when you have a problem. Nobody is going to go for a doctor and say, what problem will come across in after 3 years or 4 years so that I can take medicine now, right? And 99.99% no doctor also can say you that, right? So our intention here is to understand the karmic pattern, right? When we are born, what is the karma we have brought? So whether this physical body is going to enjoy the comfort or it is going to suffer the ailments, unhappiness, or illness. This we want to know. So for this purpose only we are studying this medical astrology. Okay, now you are going to know this physical body is going to enjoy the comfort, but occasionally somewhere here and there, some problem you are going to encounter. Okay, you are, through the help of astrology, you are going to map your DNA astrologically that when there is going to be a disturbance. So if you know that most of the times we can find the nivurti. Roga nivurti means how to tackle that. Now, for example, you are going to know that in the upcoming Guru Dasha, you are going to get diabetes. Means it is placed in such a way. Now, from now itself, you will become conscious. What you will do a lot of exercise, you will go to gym, you will sleep properly. By that, what you are doing, almost negating that. Along with that, spiritual health, because the God or Dhanvantri is the doctor of doctor. If you see the Dhanvantri post, okay, in that photo itself or in the statue itself, will be wearing stethoscope. That means what? He is the God of the God. So by praying to God, okay, now for each and every individual, there is a specific tattva. Understand? Somebody will have fire element more, somebody will have land element more, somebody will have air element more. Different Panchabhuta tattvas will be present. And for each individual, a different planet will be causing the problem. So we'll identify the Roga Nivarti and we'll suggest him during this Dasha Bhakti, this can come. So these related prayers you take place. Accordingly, you modify the lifestyle. If you do this itself, we are giving a great helping hand to the medical fraternity, right? The job of the doctor is also to keep the patients healthy. Now, if you're making the person not to become patient, then we have succeeded one step extra. This is what you are going to learn in this what is that combined 25 days, including your batch flower remedy. Why? Because now you are saying this problem you will get, that problem you will get. You are very spot on. You are very spot on, and the client is also very happy. But if you are not saying him remedy, how to remediate it, which temple to go, or which god to pray, when to pray, what kind of medicine will suit him. Now you would have heard some people will suddenly say, sir, from 15 years I was taking allopathy. All of a sudden I took homeopathy, my diabetes cured. Somebody will say, sir, suddenly I went into Ayurveda, my arthritis got cured. Sir, of late, if you see, autism is well treated in Siddha and Chikitsa, like they will say. Suddenly, this guy will go and try. No result for him. He'll bring another family member. For them also, no result. Then he will say, no, only allopathy works. This and all are pseudo medicine. The reason is not everything will suit everyone. As on today, allopathy is a mainstream, but which other branch of medicine will suit you, that we can identify through the DNA. That DNA is revealed through your nakshatras. Each nakshatra, okay, they are grouped or they are made into different cluster, and those only will be suitable for those people. Along with this, if you take that very quickly, you can come across. All these things I'll discuss in part 2, that is your batch powers. In part 1, it's only diseases. Okay, with that slight introduction, we will slightly get into this medical astrology subject. Okay, I'll try to share my screen. Just a minute. But why the share option only is not coming? Has anybody taken Ast controller here?
I couldn't hear you, Guruji. What was it you asked? Anybody?
Has anybody
So,
taken the Ast controller? What? Because I am not able to see the share option.
so you are only the host in the this thing.
Okay, let me check 1 minute. Now, so this medical astrology, okay, if you, how many of you know how many diseases are there? Hmm? Don't Google. Hmm? Am I audible?
Yeah, sir. I don't think we can tell
Yes,
unless
Guruji.
every day new
Okay,
diseases
okay.
keep on coming.
So there is only one disease.
Mental disease, fear,
No, 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 sir. The disease of energy.
allergy. Okay, true, true.
That is the only disease we all have.
Correct, correct.
Is it like the Vata, Pitta, Kapha, three parts?
Those are humors. Okay, Vata,
Oh.
Pitta, and Kapha, they should be in equilibrium. So, as per the WHO, okay, what is WHO?
World Health
World,
Organization.
World Health Organization. So, these are the
I
people
know.
who take. So, as per the WHO data and these medical databases like ICD-11, ICD-11 is International Classification of Diseases. Okay, International Classification of Diseases. Around 55,000 diseases are there, it seems. How much? 55,000 diseases are there. Okay. Definitely, even doctors will not be knowing all these diseases. Means so much research work has done on human health. Okay. What is affecting human life, human condition has been done. Okay. But we are not bothering to this. But if I teach you the methodology, let it be any of the diseases. You will be able to tell him, because now if I am saying lungs problem, that is sufficient. Lungs problem means it can be TB, it can be pneumonia, it can be bronchitis. We need not say that. Understand? If you say his lung area should be is going to get affected, then automatically that guy should stop eating ice cream and what and all makes the cold, and where and all there will be dust allergy. All those things automatically avoids all the associated diseases will not come. That is how we are going to learn. Now, these 55,000 diseases are there, but in a clinic or in a doctor, usually they will come across the 100 major diseases. Okay, 100 major diseases only they will come across, and even in medical shops also, maximum these are the tablets frequently you will find. Other than that, if you ask, you will say, "Give me 1 day time, I'll get you." Okay. Now, these common diseases also, they are classified into different types. Basically, they are classified into how much? 6 types they are classified. Okay. The first type they call it as infectious diseases. Okay. What are infectious diseases? Can you give anyone some example?
Sir,
Most commonly,
influenza.
correct.
And
Influenza, common cold,
Viral.
right?
yeah.
Influenza, right? TB, famous COVID-19, malaria, dengue, hepatitis, whichever it is A, B, or C. Okay. Pneumonia, okay, and typhoid and diarrhea. This much, if you know, it's sufficient. Okay. Next, very, very important today, as on today's thing is lifestyle related, lifestyle and metabolic diseases. That means lifestyle and type metabolic means first thing that will come to our mind, metabolic disorder is type 2
Diabetes.
diabetes. Next is obesity, right? And hypertension. Hypertension means what? BP.
Blood pressure.
Correct. And next is heart disease. Okay, heart disease. If heart is not functioning well, and now very frequently common among all IT people, fatty liver. Okay, stroke or paralytic attack. These are lifestyle or metabolic related diseases. Third one, neurological or what? Mental disorders. For this, today, one of the famous businesses this has become depression, anxiety disorders, okay, migraine, Alzheimer, Parkinson, epilepsy. Okay, these are less commonly you will see, but as than today, these also trends are increasing. Okay. Next, fourth one, autoimmune and inflammatory diseases. Rheumatoid arthritis, asthma, psoriasis, and thyroid. It will be like both hyper or hypothyroid. Next, fifth one, non-communicable. Okay, but very, very major. Means what? Excuse. That is cancer. It can be anything, cervical, lung, whatever it is. Then other things they classify into other chronic disorders or conditions. Other chronic conditions means what? Kidney disease, okay, COPD, anemia. Okay, what is COPD? Chronic
Sir, it's the
obstructive
Pulmonary disease, sir.
diseases.
Yeah.
Okay, legs related. So these days you see now specialist called pulmonologist they will call. Okay, people who are associated with lungs and those function, they'll call them as pulmonologist. Okay, so like this, majorly these are the things diseases are classified. Okay, so we are like I told, we are not studying MBBS, but still, if you become tomorrow a medical astrologer, you should know some basic things. Without these basic things, not understand. Now, if you follow the 25 days of class, part 1 and part 2, I am 100% sure whatever I listed out here, you will be able to identify all close to 40-50 diseases we listed out. All the things will be able to identify in a chart and guide your client. And definitely your client will come with success and you will be your client forever. Because in our life, after God, we consider doctors only as God. Understand? Now, most of you know, most of the doctors also today come to whom? For their personal problems. To seek suggestion, to whom they come?
Astrologers.
Astrologers. Understand? Means God has kept us in that position, in a very respectable position. Even a doctor who saves the life, he comes, Guruji, know the solution for this problem. What should I proceed? Guruji, I want to do my eye operation. I don't know when it is a good day. Understand? This is not, here also we have one student, he is a doctor in America. For his wife, he gave that good day for eye surgery. They don't have knowledge. They have knowledge more than us in medical field. But the respect and faith they show in the subject is tremendous. Understand? Because they are believing, yes, if this person gives me the good muhurta, that thing will be happening properly. So accordingly, we have to develop our knowledge. We need to be transparent. We need to be honest. If honesty is there, money and all will automatically come. Because I left a job which was earning in green ink. Okay, working in a central government job. Why I left? Because of passion for the subject. Okay, today I earn better than that, but more than that, I have got respect from very, very big people. You name it, I can say very, very big people. Means being dedicated, hardworking, and truthful. And if you help people, everybody will give you respect. This is the only best profession, provided you are true to it. Okay. So why I am telling all this is because you should have that basic idea. Now you all have a clear idea how this disease or what it is. Right? Clear? Okay.
Yes, Guruji.
Next, very, very important thing is, which will come to our mind is diseases. After studying this course, what will happen? No. What is the good thing about this course is, while studying in this process, all of you will be very happy. Understand? Because sir is saying this combination disease form. Because already we have found in 15,000 consultations, more than 3 to 3,500 medical consultations are given. Because every alternate client will come with some or other problem, especially with health, along with this other problem. You will feel this is coming, that is coming. But at day 5, day 6, day 7, what will happen? No? You all will get scared. Why? You know why?
We'll all see the combinations in our chart.
Because all combinations will be in your
Krishna.
chart. But you should not get worried. Why? Because even students who study MBBS, no, you go and check. I have a lot of friends. I at that time interested in MBBS. I got 30th ranking. But anyhow, that's a different thing. Okay. I become an engineer and a scientist. Now, and I left that scientist job also. That's a different story. Why I'm saying all my friends who were doing MBBS at that time, everyday evenings when I used to meet them, they were kind of paranoid. Till the completion of first year MBBS, whatever diseases were taught in their medical books, they used to assume like they have got that. This symptom is there for me, that symptom is there for me. But slowly when they progress to third year or fourth year, they realized it is not. So similarly, don't get scared. Enjoy the journey. You are here not to get scared of any diseases. You are here to remediate even what is going to come in the future. Understand? Now in this course, what we will study? We will study many things. Many things we will study. But there is one lesson plan. What is that lesson plan? I will teach you. First one is introduction to medical astrology, which I already made. Showed you the diseases, everything and all. Next, disease of planets. Third, disease of Rashi. Disease of Bhava. 5. Disease of Nakshatra. This I didn't want to add, but again I thought you are all been staying with me from years and years. Like I usually always say, if not for you, then for whom? Next, important graha combinations of diseases. Okay. Next, 7. How the disease formed. Now, our disease means what combination, how it will come, which bhava, which rashi, all that. 8. Lower degree, higher degree. Not your Atma Karaka. And what is that lower degree called as? In that Jaimini? I forgot. Okay.
Darakaraka. Darakaraka, sir.
Okay. But seriously, not that one. It's a different concept. Okay. Right. One is transit moon. And this I'll teach in the last day. Otherwise, you will not understand. Ascendant means this is overall transit moon, transit ascendant, dasha bhukti, antaram suksham. Right. Oh, finally, this remedies part. Here I'll give only introduction. In the batch flower, I'll give you the full completely out remediated diseases. This is our lesson plan. Understand? This lesson plan we have kept for now 2 weeks. This one. So even if 2-3 days are getting extra, also we can do, because in December we are not having any major course apart from batch flowers. So we can even extend the days. So that is not an issue. But you all should be confident in learning this. That is the thing. And diseases, you don't worry. Minimum at least I'll anyway take minimum 20 to 30 case studies. It will not be lesser than that. That I will assure you. So in all probability, for each diseases, I'll take one case study. If somebody's live case study also, if time is there, I will take. Don't worry, like personal class, I will take. Understand, to give you the confidence. But I already have a lot of data. With that data only, I'll try to explain you. So that is also there. And if you have more team, more and more case studies also I'll take. And yeah, 20 to 30 I told means, so 20 to 30 conditions also I'll teach you separately. Okay, so that you become expert. Okay, this under minimum, you always know. If I say this much, it will usually go double. Okay, so this is our medical astrology plan. Now, another thing is here, very important thing is, okay, like I told, a life without disease and everlasting wealth is desired. Correct or not? Who doesn't want everlasting wealth and a life without disease? All of you want, right? Is anyone who is saying, no, sir, it's okay, I don't want?
No, sir, we 100% want that.
Right. Not only you want a life without disease, you also want what? Everlasting. Right. And next thing, what will come into all of your mind is, what is disease? Will it come? What kind of disease will come? One basic principle is, if your body metabolism is good, then no disease. If that metabolism is less, then also disease. If metabolism is going beyond control, too much of metabolism, then also disease. So then what is important here? Equilibrium is important. This equilibrium means what? 3 elements are there, like you all told earlier. Vata, Pitta, Kapha. If these 3 are in harmony as per Siddha or Ayurveda, then that equilibrium is balanced. Now, how to understand, sir, who will get disease, what disease will get means, suppose your 6th lord is in Badakadipati star, 100% you will get a disease. That will trouble you for a very long time. If it is in 3rd bhava, then also you will get diseases. How to understand means, whichever bhava in your horoscope, your 6th lord is sitting, that bhava will 100% have a disease. Whichever bhava your 6th lord is sitting, that bhava will 100% have a disease. Now, how to understand? For Mesha Lagna, who is the sixth lord?
Mercury.
Mercury. Correct. Now, this Mercury is in Mesha Lagna itself. That means what? Sixth lord is sitting in Lagna itself. That means Rogasthana Adhipati is going and sitting in the native place itself. That means 100% this person will get sickness. Whoever is having sixth lord connected to their Lagna, 100% they will get the sickness. Now, let us make it a little bit deeper. That the sixth lord is sitting in, let us assume, Bharani Nakshatra. Okay. Now, Bharani Nakshatra means what are the houses involved here?
2 and
Yes.
7.
And
Ah, 2 and 7. Then automatically what we can say? This person will easily get kidney related problems, kidney stones or urinary tract infection. Understand? And Mercury is a Vayu planet. Right? He is a Vayu, means gas. That means frequent, that EP area, that what is that? Kanya Rashi, that lower back pain also will frequently come for this person. Like that, easily we can say. Okay. Now you may say one thing, sir. Sixth lord you told, sir. Sixth lord is not only disease, no, sir. Sixth lord is also service. Sixth lord is loan. Sixth lord is depth. Correct. Then you may ask when to tell the disease, sir. That means who's the karaka for disease?
Saturn.
Saturn is the karaka for disease. Correct. Without the Saturn's involvement, there is no disease. So when Saturn gets connected to sixth lord or sixth bhava, or if Badakadipati is connected to this, what is that earlier placement we told, then only it is disease. Or if Rahu or Ketu gets connected to sixth lord also, 100% a person will get diseases. Now there is another case. What is that another case? Some children, when they are born only, they will have disease. Have you seen? From day one, his birth, he is having child. From first year, he is having diseases. Right? When child is born only, they are having some diseases. So what is the reason for this? The reason for that is 10th bhava. Because 10th bhava is the karma bhava. Okay. Whenever 10th lord is associated in the 6th, 8th or 12th bhava, automatically that will be karma disease. And the 6th lord goes to 10th bhava. Then also a person will get now Saturn is in 1, 6, 8, 12. Then also a person will get what? Karma or karmic diseases. Okay. That means these people somehow will naturally get disease because of karmic depth. Suppose 6th lord is in 2nd house. Then what are the problems the person will get? Eye related problem you will get. You see in that phase what and all you are below the eyebrows. Above the eyebrows will come in first bhava, your forehead and head and all. So below that eyebrow, eyes is there, nose is there, teeth is there, okay, chin is there. All this will have problem. Now you all check your aura. You go and check where is your sixth lord. Whether the intensity is more or high, that we will see Badakadipati connection, Saturn connection, all those things is later. But wherever your sixth lord is sitting, 100% related to that in your life, at least minimum 10 days treatment or monthly you keep on getting that, or some major surgery or anything will be there. Okay. Now suppose your sixth lord is sitting in Aries, automatically head related pain, migraine, sinus, okay, some scars automatically will come for that person. Their sun also gets exalted. That means automatically eye issues also will come. Now, how many of you checked where is your sixth lord and what problems you are facing?
Sir, I've checked 6th Lord in 12th house.
Which Rashi?
Tula.
Tula Rashi. So Tula Rashi and 12th Bhava. Right. So automatically what problems you are facing?
Since childhood, I've faced a lot of periods problem, stomach related problem, hormonal imbalance, migraine headache, accident once, and at present, of course, a lot of fatty liver, diabetes. Gallbladder stone.
Okay. So more or less what and all you are told, all are related to the Rashi and the Bhava you told, that I will explain in the later class. Okay. Now each one of you go and see where your sixth lord is sitting. That Bhava related and that Rashi related problems only you will 100% have. There is not even 1% deviation in that. Scanning report or blood report may go wrong. Okay. But this report will never go wrong. Now let us assume Jupiter is aspecting sixth from Lagna. That means you should not say that disease will come down. That disease will become even more. It will get aggravated. If Jupiter, for whoever is sitting here, if Jupiter is aspecting your sixth house, 100% the disease will become more. Because we should not forget one quality of Jupiter. Jupiter is what? He is a manufacturer or a producer. Wherever he is seeing, there he will manufacture more and more. Good or bad, it's secondary. But he will expand that bhava. Understand? Now, for somebody, Jupiter is sitting in the 12th house and he is aspecting 6th house, means 100% of Jupiter will give diseases. And during his Dasha Bhukti, it will be even more. Fat tumors, all things, brain related tumors, brain fever, all that will come. Even if 6th lord is aspect by Jupiter, then also he will give diseases. Let any planet in 6th, 100% that planet will give diseases in its Dasha or Bhukti. There is no exception on that. That means what? Jupiter's aspect on 6th house is good for materialistic comfort. It is good for job. It is good for money, but it is not good for disease. Clear? Because this doubt I should remove from your mind. You should not think Jupiter is seeing will it do good or not. Jupiter will expand. In malefics, first is Rahu. Because that Rahu aspect also, he will expand. What aspects we have to consider and all I will teach. But Rahu aspect also is going to expand the disease. Now you may ask, sir, you are saying Rahu is also going to aspect and expand the disease. Jupiter is also going to aspect and expand the disease. So what is the difference? That means when Jupiter gives you the problem, you can withstand the pain. And with the devotion, you can remediate it. But with Rahu, it will keep on from one diseases to another diseases, from one organ to another organ. So it will be difficult for you to remediate. That is the difference between Jupiter and Rahu. Now, if I keep talking like this, 100% from tomorrow, most of you will give up medical astrology. Understand? Sir, firstly, this subject is scary. Secondly, you are talking so many things, you are not even able to sit and write down. Okay, now what to do? So don't worry, this is just one small introduction. Understand? You can see the video and you can make the notes. We will go step by step in basic steps only. There is no 1% doubt also that. Okay. Now I'll teach you the things more in a easier way. Okay. This body is given by mother and intelligence is given by father. If disease is identified, then most of the times that disease is given by mother. If you are not able to find out that disease easily and searching here, there, everywhere, then it is given by father, like this not known, mental illness, allergy, all these are from your father. Father is like mind, stress. Now, stress means exactly where you cannot go and diagnose. Where is the stress zone means you cannot diagnose. You just cannot say it is in the brain or like that. Now, it is like a wound. It is a surgery. It is a decay. That means it is coming from the mother side. This does not have any implication, but to understand you the karma, I am telling you this. And whether the disease is going to grow or destroy, it is in the hands of the native. Okay. Always disease means sixth bhava. Handicapped. Handicapped means not only leg gone, hand gone. No. Even if they are removing some organ, that organ is no more for you means then also it is handicapped. Such defect or handicapness is indicated by eighth bhava. So always keep in the mind Disease means sixth bhava, handicap means eighth bhava. Now, next question for all of us, which is going to come in our mind is, will all of them get disease, sir? Why? Today we can see people without job, people without marriage, people without own house, people without children. But have you ever seen a person without a disease? Any person in your life? So till today in his life he has not got a disease. Anyone?
No, Guruji, we find everywhere.
Right? Disease didn't even Ramana Maharishi. Ramana Maharishi died of what? Cancer.
Cancers.
So disease doesn't leave anyone. Understand? Once you are born on this bhumi or earth, you have to get disease. Everyone born on this world will get disease. Why so? I can prove that. Because in the 12 signs of zodiac, whichever zodiac you are born, either it will be connected to sixth lord or it will be connected to eighth lord. Sir, what is this you are saying, sir? How it will get connected to sixth or eighth? Means I'll prove it here itself. Okay. So let me put one small. Okay. Mesha Lagna. Okay. For this Mesha Lagna, this is the sixth house, right? Kanya. Here, there is Sita Nakshatra there or not?
Yes, yes.
The Sita Nakshatra belongs to whom? Mars, huh? So
Yes,
sixth
sir.
house is connected.
Mars.
Here, this house belongs to whom? Eighth house.
Mars.
Mars. So automatically for this Mesha Lagna, 6 and 8 connection is there or not? Right?
Yes, Guruji, it is connected.
So it will come. Now, let us take for this Taurus. For this Taurus, sixth house is his own house. So 1 and 6 is by default getting connected for Taurus Lagna. Now, this is the eighth house. In eighth house, Purva Shada Nakshatra is there. Purva Shada Nakshatra belongs to whom?
Venus, sir.
Venus.
Venus.
Automatically 6 connection came. No, this is Gemini. Okay. For this Gemini, I go to sixth house. Here, which nakshatra is there?
Jyeshtha.
Jyeshtha. So sixth came. Now eighth. How eighth will come? Now eighth will not come. But what will happen? Here sixth lord is Mars. Here Mars nakshatra Mridashira is there or not?
Yes, sir.
Yes.
So automatically that also will get disease. Now next you take for Cancer or Kadaga Rasi. For this Kadaga Rasi,
All 6 and 12 are connected.
Kadaga Rasi, Punarvasu nakshatra is there where? Here, sixth sign. Correct? And another nakshatra also is there. What is another nakshatra? Which is connecting 8.
Pushya, sir.
Pushya. Correct? 8th is there. So 6 and 8 came or not? Right? Next, Leo. For this Leo, Uttarashada is what in Capricorn?
Sixth.
6.
Sixth. That
And 8 connection or other connection is not there. That means what? For Leo Lagna, generally that resistance will be high. Clear? Next, Virgo. For Virgo, there is no 6 connection. But 8th Lord Mars Nakshatra is there here. Correct?
Yes.
That means these people should be very careful. For these people only, like if diabetes come, this Virgo ascendant or something, automatically that may lead to this gangrene or removal of some organ. That and all, they should be very, very careful. A disease can turn into something very worst thing. Understand? And the next is Libra. In Libra, what is the 6th Lord Nakshatra there?
Vishakha.
And 8th Lord, Venus gets connected. So 6 and 8. Next, very, very important. This you check. If you are finding this combination, okay, I'm saying, 100%. Whatever medical astrology book, till today I have written 785 pages. That book also will not release in 2-3 years. Understand? Scorpio. Who is the 6th Lord? Mars.
Mars.
Mars,
Ah.
Lagna Lord.
And who is the 8th Lord?
Mercury.
Mercury,
His
Gemini.
his nakshatra is there. And this Mars
Yes,
nakshatra is there in Gemini. Yeah?
Mrigashira.
Huh? So there also 8 is there. Here also 8 is correct. Mrigashira, here also 8 is there. And automatically it connects to 6. So all Scorpio people, they are the factory of diseases. Understand? So for Gemini, Rashi and Lagna, Scorpio, Rashi and Lagna, these are the people, they will get diseases. 80% of women born in Scorpio, Scorpio, Rashi or Lagna, in their lifetime, either they will have uterus problem or they will have lower abdomen problem. Definitely all Scorpio people are the one who are subjected to more and more diseases. Understand? Clear? How many Scorpio are there here actually?
Sir, I am Scorpio.
Yes, Guruji.
Yes, Scorpio Lagna.
Scorpio means 80% of women will have uterus related problems or operation or fibroids like that. 100% it will be there. How many of
Absolutely
you had?
correct. Absolutely correct, sir.
Okay. Blindly in that one point, you can say, oh, this guy is like a scanning report is saying. Next is Sagittarius. Sagittarius, how 6th Lord is getting connected?
Purvashada
Purvashada,
Nakshatra in the
sir.
Lagna.
And 8th,
So Lagna Lord gets exalted in it.
Punarvasu.
Punarvasu, correct. Punarvasu. For Capricorn, Lagna, Rashi, this is good. They are generally strong. Why? Because there is no connection of 6th. But 8th Lord Sun Nakshatra is in Capricorn. That means what? Capricorn people will usually get back pain problems. Understand? Capricorn Rashi or Lagna. This disc problem and all they will say, back side, that and all. Aquarius, 6th house Pushya. 8th house it is not there. Pisces also, no connection of 6th, but 8th house Nakshatra, Vishaka is there. So 8th house, whenever it is getting connected, you should be slightly careful. Okay? Because that can slightly more problem. That's all. So by seeing this 2 houses analysis, we understand something. What is that we understand? Either 6th or 8th house connection is there for all the Lagna. Okay. In that, first rank and second rank goes to, first rank goes to Scorpio, second rank goes to which Lagna?
Gemini.
Virgo.
Gemini. Understand? So Gemini and this is Scorpio. Scorpio is first, Gemini is second. They are more susceptible to problems. These people are very, very careful with respect to diseases. Now, another thing they will ask you. Suddenly, a client will come and ask you, sir, can I go for treatment for this particular disease? Can I go for a surgery? Like that, they will ask you. If they ask you, definitely you will be very, very, you may put a Jamakol if you know, you will see Udayam, you will see Madhi connection, all that. But that all is not required. Of course, Prashna will give you that extra confidence. I will suggest you to do that. But whoever is having exalted planet, Ono's planet, or debilitated planet, okay, these people can go. Now, for example, somebody is having sun has debilitated. Now they are coming asking, sir, doctor has given 2 choice, either to take a tablet or to go with the surgery. Can I go with a surgery? Because surgeries are always risky, however less complicated they are. But if that person is having debilitated sun, 100% he can go for a surgery. Another person is coming, he is having exalted sun, he also can go for a heart surgery or eye surgery. Another person is having one sun, he also can go for it. That means what? This one planet, exalted planet or nature planet, how much ever you do them tinkering, denting, okay, you can somehow bring them to the shape, to the original. That the vehicle is ready to take all the damage. It will survive. It will not die in the hospital. How much ever operation, tablet or treatment is done, it will give it strength. only after coming to house it will die. Because they have capacity to bear the pain. Now, automatically a doubt would have come in your mind. Sir, for exaltation also you are saying the same. Okay, one house you are saying the same, but debilitation also you are saying the same. So what is the difference, sir? Means exalted pain. Doctor is giving you anesthesia and operating without pain. Debilitated planet, no anesthesia for you. In front of you only is cutting and stitching. Okay, that is the difference. Understand? Now, for example, someone is having sun exalted, he is asking for stomach injury. Then we can say yes, because we will have capacity to withstand that. That organ has that capacity to withstand that. Understand? Clear? Any doubt till now? Anyone? Okay.
Sir, I have a doubt. Can I ask?
Yes, madam.
Sir, here it may be a silly question, but suppose the planets are in exchange, then they will behave as if they are going back to their own sign. Do we need to consider them as well, or only the natal placements only we have to consider?
That we will discuss later, because
Okay, sir.
whenever planets are in parivartana, they will usually transform one diseases to another diseases. Okay, that we'll discuss.
Okay.
Okay. So anybody, any doubt within what is taught? Who didn't understand? Very straightforward, but still. Okay. Now, there was one very long back. Okay, those days when I was practicing, I think in that chart, Sun, Moon, Mercury, Mars, one house, and Venus was the exalted or something. Okay. And no diseases he had. If I am not wrong, that the date of birth was, I think, 17/7/1963 or 17/8/1963. I don't remember. Okay. So, but when he had come to consultation, I had put a prashna and I saw his chart and I told, be careful, somebody will put knife to your body. Immediately he was angry. I am coming to ask for my son's marriage. What kind of words you are using that somebody will put a knife onto my body? What kind of astrologer you are like that? Because those days, okay, I'm talking about 13, 14 years ago, that I was not that much polished. Today, I know how to put it. In the last 7, 8 years, I have learned how to put it to people, even if it is something bad. Those are the days, right? So 10 years we have studied. So automatically when you want to practice in the 11th year, 12th year, you want to be too much raw. Then I think during that time, the Jayalalitha XCM, she was giving some scheme also. Exactly, I don't remember. There some female related schemes and all she was giving. Okay. In that, I think that party guy and another party guy had some argument. So in the tea shop, that guy broke that soda bottle, and in between this guy came, they stabbed onto his stomach. So for that guy, they had put 30 stitches on his stomach, 30 stitches. But still that guy survived. Why? Because for him, sun was in one house. Understand? Sun was in one house or exalted. Okay. So that guy survived that. Why I am trying to say this is, whenever you are having that one house planets, or you are having that more planets in the exaltation and debilitation, automatically you will have that capacity to survive. Understand? So when anybody is coming to you, if you see that one house debilitation, exalted planets, you can strongly recommend for them to have the surgery. Understand? So this is one thing. And aspects, we will take a Rahu 311 and Mars 478, Jupiter 579. Remaining aspects are same. 7th aspect for all the planets. And Rahu Ketu will not aspect 7, so 3 and 11. So these are aspects we are going to take in the medical astrology. Any doubt in this?
Can you please repeat the aspects, Kushi? 311?
Same,
Mars?
same parashari aspects only, sir.
Okay.
Mars is 478, Jupiter is 579, Rahu is 3/11. Okay, same parashari aspects, because some of you might take Nadi aspects on Vinay sir. So I am saying don't take Nadi aspects. We are taking only the parashari aspects.
Okay.
So can I
Now,
ask a question?
uh,
So that means if suppose my 12th house is exalted, so that means you can go for surgery.
No. 12th house will not get exalted. 12th house, some planet will get exalted. The planet related organ, you can go for a surgery.
But the bhava is exalted, then you can't.
How Bhava will get exalted, madam? Madam. Bhava also will get exalted. Huh?
Like a Tula Rashi, sorry, I'm talking about Rashi getting exalted.
That is what I'm saying. How Rashi will get exalted in that Rashi, particular planet will only get exalted. No. So in that Rashi, now sun gets debilitated. So you will say Tula Rashi is getting debilitated. Huh?
Okay, got it. Thank you.
First time I am hearing in Earth something is going on. Concept like that Rashi is also get debilitated. Huh? The exalted.
No, nothing like that, sir.
Right. So in Tula Rashi, if you are having Saturn, then Saturn related organs, you can go for a surgery. Okay, sir, I want to do a knee replacement surgery. Means, yes, you can go for a knee replacement surgery. For most of the people after knee replacement surgery, it has gone worst. In your case, if you are having Saturn exalted, then you can go for that. Understand? Now, for example, you are having, let us assume, okay, Jupiter in Pisces. They are asking, sir, can I go for a liver transplant? 100% you can go for a liver transplant, sir, it will be successful. Like that, we have to say, whichever planet is getting exalted or debilitated, not a problem. You can say. Now, the same Tula Rashi, sun gets debilitated. Sir, doctor has advised me for a bypass surgery. Can I go, sir? Is it harmful for me? No, you can go. Like that, you can say. Exalted and debilitated planets, organs, you can go for surgery.
Got
Anybody,
it, sir.
any other doubt?
Thank you.
No problem. Such doubts will be there. Asking is a good thing, no?
Sir, one doubt.
One doubt.
Yeah, so the importance to be given to sixth lord or the placement of sixth lord, the Rashi.
Correct. Sixth lord, wherever it is sitting, that related Rashi's organ, it will give the problem.
And about the means the problem related will be sixth lord significators or the Rashi significant.
Sixth lord also will give the problem in its dasha bhakti. Now, for example, you are having let us assume sun. When sun's dasha, sun is sixth lord. If sun's dasha is running, stomach problem will come. All those things will be evident in the dasha bhakti. But what is that sixth lord will cause you problem throughout is wherever it is sitting, that Rashi is related organs, it will cause you problem throughout.
Okay.
Yes, Jay sir, what is it?
Yes, sir. One second. One question, sir. For avoidance of doubt, just the point that you mentioned now about debilitation, exaltation planet. This rule apply to a planet looking at its own house, right?
Come again?
This rule, it won't apply to a planet aspecting its own house,
Hello,
right?
Jay sir.
Sorry, sir. Are you able to hear me?
It should be in exaltation. It should. Now I am able to. It should be in exaltation, or it should be in one house, or it should be in debilitation. Sitting, occupation, not aspect.
Okay. Got it. Thank
you. Anybody, any other doubt?
I have one doubt. Sir, here you said that we have to look at the planet, and if it has to signify a particular organ. For example, sun indicate heart. Okay. So if sun is exalted or debilitated or it is an own sign, then heart surgery, eye surgery, head related issues, all these things he can go for. It will be like fine. Sir, suppose this sun is lording the say seventh house. And if it is in exaltation, if it is in debilitation or in any special status, then can we say that organs connected with seventh bhava can also be, we can also take that in this manner, or only the karakas only we have to take?
Only the karakas of the planet only you have to take.
Okay, we cannot take bhava, Lord.
If that seventh bhava's owner will be there, no, let us assume Venus is the owner. That Venus, if it is in own house means or exalted, we can take Venus related karakas. For this thing, only the planet related karakas we have to take.
Okay, sir.
Sir, can I ask a doubt?
Yes, please.
Sir, so disease will come only when the bhava is functioning. Bhava signification is functioning, right?
Means like
Heart disease. Heart disease will come only when the fourth or fifth lord is activated.
not really required. Even if your Saturn is getting connected to fourth or fifth house, also you will get heart attack. You take all heart attack charts. 80% of people would have got Saturn's connection to fourth house or fourth lord or to sun. That we will see later. Who will get heart attack? Who will get? For that there is a format. Understand that format I'll teach you when I go for the diseases. There is a 3-chart format. The 3-chart format I'll teach you.
Okay. I was asking when will it occur, sir? I mean, when will the heart attack?
Now only you have come to ABCD, no sir. Slowly we'll learn words,
Okay.
sentence,
Fine.
paragraph.
Okay, fine, sir. Okay, thanks.
Yes. Any other doubt?
I have a question. Now, you said
Yes,
that
sir.
8th house means removal of an organ or some body part. Now, removal of teeth also, 8th house?
Removal of?
Teeth, sir.
Sir, removal of what?
No. Teeth,
Didn't
sir.
get
Teeth.
Teeth. Now, teeth is not a organ, no, Prasad, sir. Right.
Okay, sir.
Okay,
sir. Understood. Thank you.
Sir, one question.
Okay.
Sorry, one doubt. If the ascendant is very strong, still the intensity of the disease will be there, means the person will be affected by the disease?
If ascendant is very strong also, only thing is the person who is having a weaker ascendant, he will cry. You also will get the disease, but you will not show it outwardly. That's all.
Okay.
Understand?
Okay. Thank
you. Now you put one chart. All of you put one chart. Virgo ascendant, Saturn and Mars in it. Done? So in this chart, who's the sixth lord? In this chart, who's the sixth lord?
So which ascendant?
Saturn,
sir.
And who's the eighth lord?
Mars.
Where they are sitting?
In the Lagna, sir.
That means what? This person will have lifelong problem. Understand? Whenever 6th and 8th connection is there, it is worst. If it is going and sitting in ascendant, lifelong it will be a problem. Now, for this person, Mercury is exalted. That means what? He will have the capacity to, spend the disease and to survive with the disease. Now, if ascendant is weak, he will not be able to bear that. He will suicide. Understand? That is the role of ascendant. But lifelong, this person will have disease. Now, you all may ask one question. Sir, what, sir? You told Scorpio Lagna, Scorpio Rashi like this, Gemini Lagna. Is there any variation in the individual level, sir? Any variation in the individual level based on our moon or everything? Yes, certain variation is there. If that variation is there in your chart, then definitely the disease level will come down. You want to know that?
Yes, sir.
Yes, Guruji.
Only 2 people want to know. So only for 2 people I will message.
No,
Yes,
sir, we all want to
yes,
know.
sir.
We all want to know.
So one voice I realized it's Vinay sir's. Okay, now Tripta madam. Okay. So this is Malefica, Benefica, this Mesha Rashi.
Malefic.
Basic astrology, Malefica, Benefica.
So Malefic.
This one?
Benefic.
This one. Next.
Alternate, sir. It is alternate, sir. Malefic.
Benefic.
Only two
Malefic.
choice. Only two choice.
Benefic, sir.
Next.
Benefic.
This one is so much doubt for you all.
Benefic.
So
Benefic.
we have to continue weeks of fundamental astrology classes. Dasha Bhukti, good, bad. Okay. Next.
Malefic.
Next.
Benefic.
Benefica.
Malefic.
Benefic only. No, why if I ask benefic, you are saying malefic. And that also you are not sure what is that. Next.
Benefic, sir.
Next.
Malefic.
Malefic.
Next.
Benefic.
Next.
Malefic.
Both malefic.
Next.
Benefic.
Okay, great. So, but why you all had that much of resistance? Fundamentals, you should be strong, no? Even if God comes and asks also, even Parashri asks also, it will not change.
Sir, so sorry, but you know what? You come up with such unique and amazing concepts. No, we feel that if we get the basic also, you'll come up with a googly.
Oh my God. Okay. Now, because she was answering letters, take our case only. What is your Lagna, madam?
Aquarius, sir.
Aquarius. Okay. Now, where is your Shani?
7th house.
Here, right? In Leo, ba?
Yes, sir.
Okay. So it is in Leo. So from ascendant to year, how many houses? 7 houses,
Yes, sir.
So from the Lagna law to ascendant, we have to calculate so many houses. So where it will come? Yeah, right. So
Yes,
Lagna
sir.
is life. So life factor is showing bad for her. Malefic, bad. Okay. And where is your moon, madam?
The moon, if we go by the logic you taught us in one of the classes of Rahu Ketu Nakshatra, then it is in 6th house, otherwise it's in 8th house.
So moon is in Virgo.
Yes, sir.
Okay, moon is here. Okay, this is moon's house, Karkataka Rashi. So 1, 2, 3. So from here, 1, 2, 3. Right. So
Yes, sir.
bad plus bad. No, both the combinations have come bad for her. That means what? She should be very, very careful with respect to health. Why? Because if some health problem comes for her, it will not go that easily. Okay. It can be mental stress, it can be strain, it can be, or any disease. They should be very, very careful because if it is coming, it is going to stay with them for a very, very long time. This is how you are going to find it out individually. Is it clear for everyone?
Sir, I have a question, sir. So he said Cancer and Virgo are benefic, right? So are we taking them bad because of 6-8 or because malefic we took basis the Rashi. So here do we take benefic, do we take malefic?
No. I think I'll keep your doubt here. Again, I'll come to you. Another 2 charts we will take. Then I'll come to you, will understand. Okay.
Okay, sir.
So any other person say, if you want to find out.
Sir, I'll say.
Yes, madam.
Taurus ascendant.
Taurus ascendant. So where is your Venus?
Venus is in Cancer.
Venus is in Cancer. Okay, you don't worry about exchange and all. So Venus is in Cancer. So 3 houses. 1, 2, 3. So it is coming in benefic.
Yes.
Understand? Where is your moon?
Moon is in Taurus itself.
So it is in 11th house. So 11th to 11th is there. So benefic plus benefic. Now this person is there, no. She is not bothered about diseases and all. Okay. Even if it is coming also, somehow she will think, I'll do this, it will get well. I'll do that, that will get well. Okay. Somehow they will get some help, some medical help or something. So even if it is coming also, they will be able to move on. Understand? If I say, madam, don't take cool drinks, madam, it will get cough means, no, sir, you tell remedy, I will morning will eat the tablet. Understand? That means when your life force also is good, if your what is that body force is also, moon is also good, any disease come, this vehicle can take all damage. Understand? So it need not worry. If it is coming also, it will not stay for long. Is it clear now how you are finding out? Or anybody want to give another example?
Yes, Guruji.
Yes, sir. What is
Sixth
your
lord
ascendant? Ascendant.
Scorpio ascendant.
So where is Mars?
Fourth house, Aquarius.
Aquarius. Okay. So from 1, 2, 3, 4, it is coming here. Okay. And where is your moon?
In the Lagna only.
The Lagna.
Scorpio.
Scorpio. That means what? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay. This one. This is also benefit means benefits. Majorly, you will not get any disease throughout the year. Okay. If it is coming also, somehow you will come out. Understand? So these people and all will not have big problem. Something comes also in God's grace, some thing. Only when both are coming malefic, they should be very careful. As long as vehicle is running good, if it is not running good, no. So it will take that time to recover very, very much. Clear? Anybody
Sir,
else?
when you say, yes, sir. So when you say benefic, meaning Lagna and Moon are in the same house, same
That is
Rasi.
Jiva Shakti and Deva Shakti are in benefic column.
Okay.
Okay. Now you tell me, Jay sir, we will find out what is
Sir,
your Lagna.
yes, sir. So Cancer Lagna, Moon in Cancer.
Cancer Lagna. Right. So moon is in
Cancer.
That means one house. So we have to put here. It is in malefic. Understand? And what is your moon sign?
Cancer only, sir.
Moon sign is also Cancer only.
Yes.
Okay. And that is also one house means year only. So both falling in malefic. That means what? Definitely this body will undergo surgery, operation, everything. If it is coming means minimum it will give 3 months, 4 months bed rest. Okay, Ajay sir.
Correct, sir. Correct.
Correct. Right. Now you would have got answer. Now you would have got answer for your question of last year.
Sir, can you please
Sir,
can you
I'm still
please explain once
confused.
again, sir?
Sir.
Can you please explain, sir? Because not able
Okay,
to.
Professor sir, no problem. I will put one more fresh chart and I'll
Yes,
take
sir.
your example only and teach.
Little confused.
So, sir, when you took one, you didn't take one as in the same house. One is you plus one.
Plus one only we have to take.
Okay.
Actually, I wanted to give that as a unique case study, but like God is always great. He gave your example, and he not search anywhere else. I wanted to give. See, there is one exemption. Don't take it as thing, but like how that is a universe plans. Okay,
Sir,
now you
yes,
all
sir,
know.
very blessed.
I will ask you.
For others, we have to count normally only, right? Like from that sign to their sign. Only when the Lagna Lord is in the Lagna, we have to count like that.
Correct. We will put like good, bad. Yeah. See? Bad, good, bad, good, bad, good, bad, good. So these are the things, right? So now, Professor sir, what is your Lagna?
Sir, Leo.
Okay, Leo. Where is your sun?
In Scorpio.
Sun is in Scorpio. That means, oh sorry, this I made mistake. I put it in Cancer. No. Yeah, right. So 4 places it has gone, no sir. So 1, 2, 3, 4. It is falling in benefic. Right. No, sorry, not bad.
Sir,
Bad. Okay. Now, where is your moon sign, sir?
In Cancer.
Moon sign is in Cancer. That means in 1 to 1 is here also bad. Now, bad plus bad. That means what? He should be careful because if any diseases comes, means it can make him sleep for 1 month or 2 months like that. Understand? So this they should be very slightly careful.
Understood. Only for Lagna, we count from the Lagna Lord to number of houses.
Correct.
Got it.
Anybody else wants?
Myself. I didn't understand that concept. So myself, it is Sagittarius sun.
Sagittarius. So where is your
Sagittarius.
Jupiter?
Jupiter is in Virgo.
Jupiter is in Virgo. That means
Virgo.
what? 10 houses from Lagna it has gone. So from here, this Jupiter, you count 10 houses. It will come here. Right?
Okay.
Good. Now, what is your moon sign?
Moon sign is Virgo itself.
Astava.
Asta.
See, by Anand Rao sir discussions itself, I had one speculation that it should be Asta. Okay. Okay. Now, here it is moon. From Karkataka Rashi, how many places it has gone?
3 places.
So you have to count 3 signs from here. 1, 2, and 3. So good plus bad. Good plus bad means what you have to do. Generally, this person will have good health only. But that 6th Lord Dasha Bhukti, 6th Lord or 8th Lord Dasha Bhukti, those times you should be careful because those times it will give you health problem. Otherwise, is no problem. Got it? Good plus good, no problem. Somehow that vehicle, how much tinkering you do, dent you do, also it will get ready and it will run. Okay. Good plus bad. It is also good only, but then that bad Dasha Bhuktis are coming, they should be careful. Bad plus bad, definitely they should always see for the Roga Nivritti. Okay. Wherever they are having the 6th Lord, no, that to see that Roga Nivritti, that related everything they have to pray because if it comes for them, minimum it will make them 1 month to 3 months to 6 months sleep. There is not even 1% doubt. Okay. So
Here
these people should be.
Here 6th Lord means from Lagna we count or?
From Lagna only. Lagna 6th Lord.
That is Venus. The position of Venus we have to consider.
Correct.
Okay,
Position of Venus and out Nivritti, that I'll teach you in the second.
Okay,
No problem.
Thank you.
Sir, I have a
Sir, for moon, we count from Cancer to moon, sir.
Correct. For moon, you have to take from Kalapurusha's 4th Rasi. Kadaka Rasi to wherever it is there, you have to count.
And then so many houses forward.
Correct.
Okay.
So, sir, I'll just want to confirm once again. Suppose if moon is in Cancer, then we have to add 1 to Cancer and it will come to
Simharasi.
right?
Simharasi. Correct.
And similarly, if Lagna Lord is in the Lagna, we have to
Next house
again
it is.
add 1. We have to go to the next
Put it in
house.
the next sign.
So these are the only exceptions, right? Everything else is
Correct.
fine.
Why? Because in your Gemini classes and all, you will put there only, na? Lagna Lord and Lagna only means. Right?
Right, sir.
If I'm not wrong. So that is the reason I said it specifically here. We should not put like that.
Okay, sir.
Sir, do we have time to calculate mine also? A little bit.
I have time. Student, I did class till 1.
Lagna and Libra moon.
I did class till 1 o'clock night for your Tambulam. 1:30.
Yes, sir.
Okay, so Gemini Lagna. So Gemini Lagna means where is the Mercury?
Mercury is in 12th house for me, sir.
Okay, it is here only. Right? So from here, that is from ascendant, it is in 12th house. So 12 plus this means it is in bad. So where is your moon now?
Libra.
Okay, moon is in Libra. So from Kadaka Rasi, it is 4. Right? So 4 signs, 1, 2, 3, 4. So bad plus bad. That means you also should be careful. If it is coming sometime, then definitely 1 month bedridden will be there. Minimum you say 1 month, it will never go wrong. They will have to get hospitalized and stay in bed rest. In their life, they would have come across. Without that, that vehicle will not move forward. It will face that. Okay.
Sir, मेरा भी देखना.
मेरा भी देखना. What is your name? You have to say
Rahul. Yeah, Rahul.
Okay. Tell me, where is your Lagna?
Taurus ascendant.
Taurus ascendant. Okay, where is your Venus?
Aries, 12th house.
12th house. So 12th house means this is your Venus. So 12th to 12th is good. Pisces. Okay, where is your moon?
Aquarius, 10th house.
Aquarius, here. Okay. So it is in what? 8th place. Correct?
Yes.
So 8th to 8th. 7 and 8. It will come in this one. Virgo. So Jupiter plus Jupiter. So don't worry. Whatever happens, this vehicle will get ready, repair itself, and it will go. Yes. Okay. How much of dent damage is giving also, this vehicle will move.
Correct, sir. Yes.
That's all. Understand? So this you align with the what I first taught Kalapurusha wise, if you mix both, you will get the perfect answer. Clear?
So,
Now,
sir,
Kalapurusha wise, certain Scorpio people are bad, but when I put here, it became good for them individually horoscope wise. So that is the reason. If somebody saying no, sir, I'm Scorpio, I'm very strong, means this rule you put, automatically they will be good in that. Yes, Shakti madam.
yeah, so sir, in my case, as you said, you're
Ah,
right. So
mm,
I have got, you know that also, I have got multiple
mm,
health issues, and it is not
correct.
from today, like it's from my
Mm,
childhood. So, like,
mm,
I have grown up, my mother crying and saying that
mm,
their astrologer used to say that my child should not be made till age of 14.
mm, mm,
That was my condition. Okay.
mm,
But what I have seen in myself,
mm,
that yeah, I have hordes of diseases and other things which are there, but
mm,
I come out of it very fast. So maybe you cover that
mm,
later, that
mm.
what makes that the revival in me. So
We will see everything, madam.
yeah,
Okay. But
yeah.
what I am saying, you are reviving. Hopefully, in God's grace, that should be the same in future also.
Yeah,
Understand?
yeah. So
This
I
is a,
have many
this is
new
ah.
things, but like I
That's
rebound
what I'm
back
saying.
very fast. That's what I
This is
said.
a caution because you are still in mid of your life. It's not the end, right? You are in the
True.
middle age only. So still, see, you should be careful because if that comes, see, there are certain people. So now, for example, I can say my friend's grandfather lived 106 years. Not in a single day he was bedridden. On the last day also, that day night, that person got heart attack, he died. Otherwise, till that 105 years, he was working healthy in agricultural field.
Hmm.
Okay. But there are few people, if they get sick, 1 month, 2 months, they will fall off. Till then, they would have not got that. Okay. So these things are the things we are concentrating. Accordingly, they should plan up. Now we will come to know, no, right? When you will come, okay, sixth
Okay.
Lord, eighth Lord, when it will be severe, all those things I will teach. Okay.
Sure.
So this is the thing. So I hope, Niti madam, is your doubt clear now? How to take
No, sir.
this?
No, sir.
Okay.
So I've understood the
Mm,
concept. My
mm,
confusion is, for example, in my case, moon is in
mm,
Virgo, right?
mm, mm,
Virgo, as per the chart that we've seen, is good, and so
mm,
is Cancer. So
mm.
it is good to good. Then why did you take bad for moon in my case? That is my confusion.
That is what I'm saying. We should not take this moon sign. Wherever moon is occupied, how many houses it is from Cancer? That
That's
you
what
have to
I'm saying,
call.
sir.
Uh,
That is what I'm saying, sir. Moon is in Virgo, right? So from
okay, right. Now, right. Maybe this doubt maybe be for others also. I'll clear. Now your ascendant is this one only, no?
yes, sir.
Right. Now your ascendant Lord, you told it Saturn is here. Correct?
Yeah, that I understood, sir.
Correct.
Yes,
But
correct.
here it is M. I am not taking this. I am not taking this. From
Mm-hmm.
this, from ascendant, ascendant Lord has come 7 places. No,
Yes,
same
sir.
number of places I am again counting. But in your
Understood.
case, coincidentally, it is falling here, so I took it malefic.
This
But this
one I
is
understood, sir.
understood, right?
And I understood.
Similarly, for moon,
Yes, sir.
your moon is here.
Yes,
Okay,
sir.
this is the
Yes, sir.
Karkataka Lagna. You consider this as another ascendant, right? You consider this as another ascendant. Here,
Okay,
ascendant
sir.
Lord has moved how many places?
3 places.
So from that ascendant Lord, should I
Oh,
not
okay,
count
got
3
it.
places?
It has gone to Scorpio, so
Ah,
that way it
ah,
becomes malefic.
got it.
Understood, sir.
Ah,
Got it, sir.
ah, ah,
Understood. Thank you,
mm,
sir.
ah. Clear for everyone now?
Sir, I have one question.
Ah.
If the ascendant lord is in Rahu Ketu Nakshatra, will you still go straight or will you go reverse?
No, that we will leave. That is a predictive astrology course. If you sit that, that will go different way. Okay. As of now, whatever you are seeing, you see that. Yes, Rahu Ketu Nakshatra means we have to go different way. All that is there. But again, that also there is Maha Yoga degree. If Maha Yoga degree it falls means we need not to take that. That and all we need not worry now. Here one exception is there. Okay. What is that exception? I'll tell you. Now, this house, what is it? Is good house, ah?
Right.
This house is also good house,
Yes,
ah?
sir. Yes, good. Good house.
Suppose here Rahu or Ketu is there, you have to take it as bad house. So instead of G plus B, it should be B plus B only. Got it?
Okay. Got it.
Not for Saturn and Mars and all, only Rahu and Ketu. That is the
So
note.
whichever house they are placed, then we have to take it as a bad house.
Naturally, you are putting good, no? There it will become bad.
Got it.
Because if I say in the beginning only, you will get confused. Okay, so this is an exception. Clear? If you don't take that exception, prediction will go wrong.
Now, sir, good house will be less, sir.
Sir, I have a doubt.
Yes.
Sir, if it's in an ascendant itself, the moon is there. So then, do we need to consider like the third house as this one? For example, mine is in Cancer. Okay, in the ascendant itself, moon is placed. Okay, so do I need to take the Virgo as the like?
Why you will go for Virgo?
So how to check?
No, already we did in JSR's case, no? For JSR, his Lagna was also Cancer and his moon sign was also Cancer only, no?
Ready.
Okay, who's this? Sir, your name?
Sir, Harish, sir.
Harish, sir. Okay. I'm not able to. Okay. After a long time, I'm seeing in class. Busy with work. Okay. So, how is you're feeling good now, sir? Okay.
Yeah, yes, sir. Better now.
Okay. Fine. What is the moon sign, sir, for you? Cancer.
Cancer.
That means instead of putting this moon here, we have to put it here. One sign we have to take from here. So, it is malefic. Now, what is your ascendant?
Cancer itself.
Again, it is also malefic. That means what? If some healthy, as long as healthy issues not coming for you, no problem. You are a very strong person. But if comes, no, you will keep on doing repeated visits. It is happening or not?
Yes, sir. It's happening.
Now you got the answer for your problems.
Yes.
What is happening for you now? Right. Recently you are having that problem only, no? That's all.
Yes. Almost weeks.
That's what I'm saying. As long as vehicle is going good, you are a very strong way. Harish means the great person, man. Like that they will say. Now you will know why these vehicles are all of a sudden got jolted. So this kind of vehicles should be very careful. They will be like rock. All of a sudden it will fall off.
Correct. Thank you.
But don't worry. In bachelor classes, I'll give you the remediation and all. Don't worry.
Okay.
Sir, are there exceptions to this?
What, sir?
Are there exceptions to this, sir?
No, exceptions we will study as a no. For this, direct exception is not there. But as you go and study more and more, we'll come to know who will really come across that, who will not come across that, who is having some these things and all. We'll see. And even if it is not there, also we have so Brahma Sutram remedy class. There we will remedy.
Yes. Because, sir, by God's grace, like though I am bad plus bad, the problems have not been there. But like you rightly said also, like the age, as one ages, probably that thing will happen.
Correct.
Understood.
Correct.
I should be careful.
Correct.
Understood.
Okay. Careful. That's all. See, whenever we know something, we're just being careful itself will avoid 80% of the problem. Right?
Exactly.
So that's all. And remaining 20%, we know the spiritual things and those things which I will be guiding all, of course. Okay.
Yes.
So this is the thing. Okay. So these things are, like I told, clear. So is this clear for you all?
Yes, sir. Check it carefully.
Yes, sir.
Okay.
Clear.
Okay.
Yes, sir. So if sorry, sir. If ascendant lord is in ascendant, we go one place forward. But if moon is in Cancer, we go one place forward.
The same thing only I taught now, no, sir.
Yes, sir.
For
Yes, sir.
Harish, sir, what did I teach? That is moon ascendant. This is Lagna ascendant. That's all. Okay. Moon is in Cancer, moon in Kadaga Rasi means automatically it will go to Simha Rasi.
Okay, sir.
Okay.
Okay. Thank you.
Same principle only.
If ascendant is in 12th house, it will go back one, right?
Correct. If ascendant is in ascendant lord is in 12th house means automatically behind house it will go because 12th sign from there is behind sign only, no?
Yes.
Sir, here what the good thing is like if we are having the moon calculation placed in a good house, So that we can say if Lagna isn't bad and moon isn't good, so probably body will face challenge, but the person will not give up easily and he will fight back to come in.
That and all we need not say, sir. Very simple. 3 rules. Good plus good. This vehicle, how much ever you eat, danger, every people will see. This guy is getting so many problems. This is, but he is not sleeping. Somehow he is getting ready and he is moving. Okay. This you have seen the James Bond movie. Everything would have come out of that car. Still that car will run.
Yes.
Understand? That is that case that is. It will not bother. You tell, hey, no man, don't go to swimming pool, you'll get freezing. Still that guy will go and he'll tomorrow morning he'll take one cetirizine and still he will run. Understand? That is first case. Okay. Now second case is what is that? Good and bad. These people are also like that only. But if some bad dasha bhakti comes in, they should be careful. Why? Because that will trouble them completely in that dasha bhakti. Again, that dasha bhakti is gone, means they'll become normal. Understand? The third one only should be careful. Why? Because when they get something, they'll get lot of mental stress. Will this get cured, sir? Is it going to be something very decisive for me? Like that, they will completely lose. Very, very strong persons they will be, but completely they will lose hope. That is third category. Okay. So for them only we say, because they will say no. The strong person sometimes will have the takes tough decisions. Understand? So those people should be careful. Again, this is a outlook which is very, very particular to your horoscope. It will work most of the times. But again, like I'm saying, there is something called as dasha bhukti. There is something called as remediation. There is something called as negation. Okay. Now, anybody tell me any one of yours nakshatra? One person, any person.
The nakshatra of which planet?
Sir, Aradhara
Moon
Nakshatra.
nakshatra. Aradhara nakshatra.
Nakshatra.
Okay.
Kritika.
Whoever told first, I'll take that. Okay. Aradhara nakshatra. So, Aradhara nakshatra, Arnab sir is born. Sir, what is the pada, sir?
Sir, Aradhara Nakshatra, 4th pada, sir.
Fourth pada. Now, for this Aradhara nakshatra, what is the Vainashika nakshatram?
So, Mercury Nakshatra, sir.
Okay. Now, how to take means very simple. Aradhara
Revati.
nakshatra is correct. Aradhara, if you for people who don't know, very simple. Okay, Aradhara to Swati is 10th. Swati to Satabisha is 19th. And 20 is Purva Bhadrapada. 21 is Uttra Bhadrapada. 22 is Revati. Okay. Now 22 is Revati. Automatically Revati means what? Mercury. Now Mercury will give what? No, the problems related to skin. Understand? So 100% this person will get in his life either nervous debility or skin problems. Such things will come to him. He should be careful. That's all. Because that is his Vainashika Nakshatram. Correct or no,
Yes,
sir?
sir. Yes, sir.
Oh,
I have skin issues.
that's all. Understand? Now, what we will not, you will all not understand because some of you are not studied Panchan. Now, if that Vainashika Nakshatradhipati becomes Karnadhipati, if that Vainashika Nakshatradhipati becomes Yogadhipati, if that Vainashika Nakshatradhipati becomes Mudkadhipati, if he becomes Karma Nakshatram, if he becomes, what is that, Karananatha, these things and all are here and there variations will come. That is not required. When we do Bruhat Panchangam, that time we will see. But as of now, why I am saying all this is because even if that Vainashikam is, it will cause problem. How much it will cause, how much it will not cause, there are other factors of the Panchangam. Understand? So similarly here, you need not worry, oh sir, like this. No, yes, Jay sir told us a problem, Arish sir told us a problem. But it doesn't mean they are completely bedridden. But yes, they had a problem. But they were in God's grace, their punyam, they did something good in the past. Their parents are there. They are walking now. Understand? They're in a good position. That is what we also pray for whoever is associated with us. No, they should be good. It's like a family. But there is an exception or here and there will be there that we will see as you go across. But in general, this rule will never change. 99% of the time, this is there means in your backside of your mind, you should always keep that in the mind. Understand? I also had that rule. I also, when I met accident during in my engineering days, I was 2 months bedridden. Understand? Then what we do with the Guru's knowledge, when we learned astrology, everything and all, we slowly try to remediate. and we are not able to completely put it away, but we know when is good time, when is bad time. When you know bad time, we avoid. When it is good time, we take that risk. That's all. Astrology is that only, no. Right? You cannot change your birth, but always you have a choice to alter the route. Correct? Clear?
Sir, the
Is
star,
it?
the star needs to be taken from moon only, or I can take it from ascendant also. 22nd star.
Sir, that and all you should not take, sir. Always moon only. Understand?
Okay.
All of you don't go beyond and think. Okay, beyond if you are thinking means you can apply. I am not stopping here, but here stay within what I teach. Still you will be able to make good predictions. Whatever you know, you have to and you give prediction. I will not discourage. Understand? But now you keep it very, very simple so that you will learn what I am going to teach. That way it will be easy for you. Okay, nothing wrong. See, ideas are good only. Okay, so why not applying only to moon? From ascendant is a life force also we can take it. Now another person will come and ask, sir, I have a problem in my birth time itself, sir. I don't know whether it's Jupiter's fourth pada or Saturn's first pada. Right? Then total that Vainashikam concept itself will go wrong. So as of now, which gives us solid proof without any problem is moon's nakshatra pada only will give. Why only moon's nakshatram should be considered as Vainashikam? Already taught in Kumaraswamyam nakshatra classes. Okay. So you all of you follow only that. Okay. When you go 5th class, 6th class, 7th class, no, you will understand. Yes, what Sar was saying correct only. Like that, you will definitely understand. Don't worry, in medical astrology, only few books. What books are there in the market, I can write and give, they are useless. I am not a person who will criticize anyone. All of my students who are with me from 8, 9, no. But in terms of medical astrology, really we don't have good quality books. Even somebody who is a doctor or somebody who written also, we cannot predict anything. But in this 2 weeks, if we dedicate, like the initially whatever disease I told, more than that also you will be able to diagnose. There is not even 1% doubt. Like all our other course, this will be also a flagship course. Don't worry. Anybody, any other doubt? Something you didn't understand? Yes,
one
sir.
simple doubt, and it is related to Panchang also. Lot of astrological remedies are based on donations of items which are related to planets. Okay?
Correct.
Right, sir? So in case the planet is becomes a yogi, like you have taught us Panchang, like it becomes yogi or Karannath, would you still recommend that you donate, because that will, isn't it will weaken that planetary strength? I mean, the being a Karannath or being a yogi.
No. See, actually, the thing is, whatever it is of a Karanatha or Yoganatha, donation is not a problem. Why? Because already you have that planet's character excess in you. Okay. So that planet has already blessed you, because a person is donating. Why? Because he's already having excess money. A poor guy cannot go and donate, right? He already is poor. Right?
True.
So that way it is not problem. But whatever is of Ayogi, that you should not consume. That you should only do the prayachitam. Okay, that is the reason in our Kumaraswamy also I will be saying, whatever is your bad nakshatras, what I will say, you should not eat.
Yes,
right?
sir.
You should only donate.
Donate it. Yeah.
Donate it. Correct. Similar thing.
So can I ask something?
Yes, madam.
So on the same lines, like how we are discussing, you'd also in one of the courses taught us about trees associated with nakshatras, right? So my question is that if it is a Venachik nakshatra, so planting the tree of that nakshatra, would that be counted as donation or a remedy, or would that increase the energy?
That tree you should not grow in your house, okay, because you are activating the Vainashikam character. I already told you, even in numerology.
No, sir.
You should,
Not in house.
I am coming to your
Yes,
answer.
sir.
Then
Sorry,
again,
sir.
I'll take your question. No problem. Okay. So that we should not keep, like I told, even if you're keeping changing a name, if it is falling in Vainashika Nakshatram, keeping that name, you will fall sick or you will feel less energetic. Now, what is the best solution for that is, your idea is excellent, sir, related to the tree week. Yes. That tree you have to donate to a temple and you have to water it. Or if you're living in a remote area where there is nearby, there is like a forest. Now, for example, Kritika Nakshatra is your Vainashika, let us assume. Kritika indicates a forest area. Vanapagati, they will say, means the forest area is Kritika. There you can go and pick that Kritika related tree and you can water. Or you can keep it in a Murugan temple and you can water it. Understand? That
Okay.
is good for
Understood.
Vainashika Nakshatra.
Understood, sir. Thank you so much.
See, if you all want, Monday I will give Pada wise also Vainashika Nakshatra and this thing. But beyond that, you will not be able to go because medical astrology syllabus is very, very vast. If you are interested, you can take others. You can take the Panchang 50 hours course, you can study. But from medical astrology perspective, if you want, I will teach on Monday for each Nakshatra Pada, what is the Vainashika. Understand? And how it will give you the problem. That much we can cover because if you are having that interest, we can do. There is no harm. But beyond that, and all, we cannot go like yogi, avayogi, because that Panchang concept itself is 50 hours concept. It is not that easy. But definitely, this I will teach you. Vainashikam, Nakshatram is very, very important. That Monday I will take up. Don't worry. First half an hour for all the 108 padas, I'll give you the Vainashika Nakshatras. Don't worry. Okay? Not an issue. That we will do. Any other doubt? Okay, fine. I will not take feedback from everyone.
Sir,
Okay.
sir,
Yes, Anand, sir.
in previous case, sir,
Mm.
if that ascendant lord is retro, then in what about in that case, sir?
Let it be any condition, sir. We are not worried at all. From
Okay.
ascendant, from ascendant, where is ascendant lord? From there, that many plus this will count. That's all. Whether it's in Rahu Nakshatra, Ketu Nakshatra, it's not required here. Okay, because there is exceptions to that. That we use in predictive astrology. That we will see when we take higher predictive. We'll see that here this you apply 100% it will work. Only thing you have to keep in mind is if in a good house like Venus house, Mercury houses and all or Jupiter houses, if Rahu or Ketu is sitting, that good house also will become bad house. See, for me, I am having Pisces as one of the house coming. That was good plus good only. Understand? Automatically in that house Rahu is sitting. So automatically it becomes good plus bad for me. Okay. So that Rahu or Ketu are sitting means that good house will become bad because Rahu and Ketu are the people who are going to, what is that, cause you the problem. At the same time, Rahu and Ketu are the one who are going to help you for doing this surgery, operation, treatment and all. They are only there. Okay. Before I leave you all, take one small chart. Okay. Monday I'll continue, but you take this small chart and think of it. Or you want to go?
No,
sir,
sir.
we'll take.
No, sir, we'll take the chart.
Okay. Now put one chart. Jupiter in Leo. Jupiter in Leo. Now mark the three rashis where this Jupiter is seeing. What are the rashis this Jupiter will see?
So Aries, Sagittarius, Aquarius.
Okay. Okay. You write planetary aspect and disease. If you want the topic, you put planetary aspect and disease. So like you all told correctly, it is seeing Sagittarius, Aquarius and Aries. Now, stomach is indicated by Jupiter, sorry, Leo. Correct? Stomach is indicated by Leo. I'll teach you, don't worry. All the Rashis, all the Graha, everything I'll teach, don't worry. Okay, but stomach is indicated by Leo. There Jupiter is sitting. If a disease is coming for this person, if he's going to some hotel, he got some food allergy or something. If that stomach problem is coming, automatically it will affect his head. That means what? Immediately when stomach ache comes, he will say, "Yo, my head is also paining." Over a period of time, whenever stomach pain comes, leg also will pain for him. Okay, that means to get rid of his stomach pain, only if he takes tablet for headache, his stomach pain will go. You got it? How to take the aspects?
Wow, sir.
Yes, sir.
Yeah.
Yes, sir.
See,
Amazing.
this and all, nobody will teach you. I'm saying on record, you go and search all the books in English, Kannada, Tamil, Telugu, nobody will find. Only me and my Guru Tirthinu Malayan. From there to me and from me to all of you. Okay. if you see, sometimes have you seen, you will get stomach pain and that person will say headache, but nobody is able to see. But you see these aspects. This is like, for me to get from my guru, it really took 12 years. Understand? And 10 years I have practiced. But from me to you, it has come easy. That means what? You are all deserving more than this. Okay. You all deserve more than this. I am ready to give everything, whatever I know in this medical astrology. But working out, taking case studies for 6 months, 1 year, it's up to you. If you show that interest for 6 months, 1 year, definitely I am ready to hold your hand and take you all to next level. This I keep saying for all courses in the last 8-9 years, and this is also no difference. Okay. Remaining few more case studies also like this I'll take on Monday. It will be like practical only. Some theory, some practical. And doubts, again I am saying, you should ask what is taught. Within that, if you ask, it will be not only useful for you also, for other students also, who are sitting there, no, they will also get clarity. Now, if you're asking something behind, like already what you know, it will, firstly, I will not answer. Even if I answer also, the people here will get more confused. And very, very important thing, sir, somebody has written in that book like that, sir. This famous Guruji is sitting in Himalaya and teaching like this, sir. That is their thing. Who I am to go and say they are right or wrong? Right. I am nobody. Sir, somebody who is having 25 lakhs of years, that person is saying that is their thing. Right. How I can go, they are teaching right now. What is right to me, what I have learned, what gurus have taught to me. Gurus had 40, 50 years experience, and in my 22 years of journey, what is coming perfectly right, I am teaching you. In that, if you are having any doubt, you are always free to ask me. Whatever it is, I'll clear. But I cannot say that book is wrong, this book is right, this teacher is correct, that teacher is wrong. Right. End of the day, make your own discretion, and you up. I can always vouch for that. My guru's knowledge will always give you the good result. Okay, because for this medical astrology, some 5-6 new faces have joined. Right. So for you all, I have to say that because you all also joined in a belief that the sir will give you some good knowledge. For old students, I need not worry. They already know me. They'll not even ask. For new people, this is my suggestion. To have that faith and trust, definitely like this, our old students also, you also will continue for another 7-8 years this journey with me, or even more than that. Okay, even double times than that, because each journey will be enjoyable. Okay, any doubt till now? Clear?
So, sir, this is purely Kala Chakra based concept, no, sir? With Jupiter
Sir,
in Leo.
total
Kala.
astrology is based on one Kala Purusha only, sir. Okay, only 15% is what you are individual. Otherwise, complete astrology it's only Kala Purusha. Without Kala Purusha, astrology itself will not work. Okay. Kala Purusha is the fundamental. Without Kala Purusha, you cannot give any prediction. Even if I don't know your birth chart placements also, just with your Lagna, we can say most of the Lagna also not required, sir. Lagna also is not required. Okay. Now, if you are sitting in a mobile or laptop, if you are able to, can you, what is that? Okay, fine. This is not a Prashna class. Okay, if it was a Prashna class, I would have shown. Just what you draw. Okay, not even the house. Your inclination, your degrees of how you are drawing itself can say how your life is going. That means what? Everything is Kala Purusha. Okay, with Kala Purusha, we can say everything. It is like you are saying, na, all your father, your mother, your brother, all of you will have same genes, same DNA, same commodity. What is changing you and them is there is something called as SNPs, single nucleotide polymorphism they will call. That SNPs are only going to vary. Otherwise, if you take the chromosome, more or less they will have the same structure. That means what? If I know what you are doing now, I can easily understand how your father was in his adulthood, more or less same, or your mother was. One of the characters you would have acquired heavily. And astrology is also no difference. Okay. So for everyone, students, all students know, Kala Purusha, you should be very strong. Nothing is beyond Kala Purusha. Correct or not? Okay. So anybody, any other doubt? Okay. All clear?
Yeah,
All good?
sir,
Okay,
just
fine.
no doubt, but I want to share one thing here. Like you said, na, this abdominal issue or stomach issue. So I get sciatica pain sometimes. And when I take antacid or something to clear the stomach, my pain goes.
That is what I'm saying. That is the reason I'm saying people only consider their root cause. But that planet where it is seen, that is very, very important. Because of that planet only, you will get all this problem. Of sciatica means what? Backside here and there, you will have problem. So who's talking? Rahul Sara.
Yes, sir. Yes, sir.
Hello?
Yes, yes, sir.
Rahul sir only, no?
Yes, yes, sir. Rahul.
Now, you are having any planet in Leo, sir? If you are having malefic planet in Leo, definitely you will have these stomach issues.
Yeah, sir. 4 planets in Leo.
4 planets are there. What all are there?
Rahu, Mars, Jupiter, and Saturn.
Rahu, Mars, Jupiter, and Saturn. Okay, now Saturn is there, Mars is there. Now Saturn is aspecting what? Automatically it is aspecting Libra and Aquarius and Pisces. Correct? And
Yes.
Mars is also aspecting, what is that? Scorpio, and it will also aspect Aquarius and Pisces. Correct?
Yes.
Sorry, Saturn will not aspect Pisces. Saturn will rather aspect Aquarius and
Taurus.
this one, Taurus.
Yes.
Right? So, but commonly both of them are expecting Aquarius. Aquarius is leg, nerves, backside, all
Correct.
these things are there. Automatically, whenever you will get stomach pain, you will get constipation, you will also get leg pain, you will also get sciatica. Correct?
Correct, sir.
That's all. Answer is there only.
Yes.
So you will not only say this person will get stomach pain, along with stomach pain, what are the side effects you will get also, you can automatically say. Now for this person, Saturn is aspecting that Libra also here. That means what? Whenever he is going out, especially and having food outside, no, you will have constipation problem. Along with that, sometimes you will get burning urination also. Understand?
Yes.
Over. And most of my students know here, if you are having 3 malefics in Simha Rashi, okay, not relevant to this subject, but chart. But generally, if there is 3 malefics in Simha Rashi, marital life also will have a problem. If you want, you all go and check the charts. 3 malefics in Simha Rashi is not good for, not only for stomach, but for marital life also. Okay. So like that, here, whatever tips is possible, also I will give. Fine. I hope it is clear. Any new 2 students I will take feedback. Others I will not take because already it is 10:30. Okay, just to see. Old students I know I will take with old students after 4 or 5 days. Any 2 new students? Yes, Aditya sir, or who's that new students are there? Rahul sir. Rahul sir, how was the class? First to my class.
Yes,
How you felt?
absolutely astonishing, sir. Very good knowledge.
Okay, fine.
Yeah.
So you are able to follow the class?
Yes, absolutely.
Okay, fine, great. Okay, then old student will ask Arnab sir or Jyoti madam wants to give feedback. Okay, old student. Okay, Arnab sir, Prasad sir, anyone?
No, I joined a little late, but
Okay.
I think I joined around 9 o'clock.
Okay.
So whatever I could make out from it, like I really did. I'll just go through the other the notes of the. I mean, when you share the recordings, I'll go through this. But the rest of the concepts that you said, specifically with the good, I mean, taking the Kalpurish chart and measuring whether it's a good or bad, but that was very interesting, sir. So I think it is just the tip of the iceberg. And there is more to follow. Like it's similar to what you're taught in Anukul Nakshatra, where initially the planet seemed the most strongest. By the end of the class or end of the course, the strongest planet appeared to be the weakest. So I think there is more to it. So I think I'll save my comments for the last day. But nevertheless, it is always interesting and very very fascinating. To learn new concepts, which is never mentioned in any of the books that have come across, sir. Nowhere. So definitely, sir, looking forward to learning more and more, sir.
Great. So the reason why I took from the new student or old student, because new students who have come, they should feel comfortable. Old student, we are asking why, because they know the flow of the class. So if they are saying no, sir, how it is, here it is, means definitely we can improve on those factors. That's all. See, all teachers are welcome to the constructive things.
Yes, sir.
So anyway,
Yes.
Okay.
Sir,
So,
I
yes,
just
yes.
want to add something, sir.
Mm,
Very
mm,
novel, very unique, very
uh,
simple, I would say. And the
mm.
way you explain things, it's so innovative, rather, that it's very difficult to forget, sir.
Thank you. Thank you.
So,
Thank you so much.
so thank you very much
If
for
it,
this, and always the best. Thank you.
Thank you. So if yes, like Professor told, it is difficult to forget for a student. I think that is the best compliment any teacher can get. Right at the end of the day, the teacher teaches, screams or explains again and again. Only that is because the student should even not forget, even should not expect that recording, but still it should sit in mind. So if that feedback compliment, if I'm getting the first day of medical astrology class itself, then definitely I take we are going in the right direction, like Prasad sir and Arnab sir told. So
Also,
thank you.
another one,
So uh,
another small thing, sir.
uh,
After a long time, I'm away.
away. Okay. Right. Correct.
Thank you, sir. Thank you.
Otherwise, say 10 o'clock only we will leave off. Okay, Jay sir has raised hand. I'll take Jay sir's comment and I will wind up. Yes, Jay sir,
Yes, sir.
please.
Yes, sir. I know, sir. We are already very late, but very short one only. And
No problem. No
I don't want to
problem.
repeat already what is said. But sir, what is most unique about not just this course, what you've introduced in the last 2 hours? What is most interesting about all your courses also is you not only show what is what, and you unravel some of the deeper secrets which are not easily available anywhere, but also you teach us how to think. See, doing astrology is one, but how to go about thinking about astrology is a totally different thing. If you think rightly, then more often than not, you will come up to the right conclusion. So that is something very extraordinary about all your courses. So again, thank you, sir. It's a privilege to be in your courses.
Thank you. Thank you. All our very old students, and getting this feedback from old students is more significant. New student, 1 or 2 classes they would have joined, they would have felt good. But people who are traveling like 35 courses, 40 courses continuously if you're getting, yes, that always keeps the moral of the teacher very high. And Jay sir, it's like already 12:30 or 1 o'clock in your place. But still you gave that. Thank you. Yes, Neeta madam, you want to ask something?
No, sir, I want to say
Uh,
that I
uh,
always look forward to your classes because,
thank you.
like how Jay said, rightly said, one, you challenge us to think. But there's one more thing that I always look forward to you is that the
Mm,
concepts that you teach us are so unique. And sometimes, they just kind of break all our notions about a lot of stuff. We think, okay,
mm,
like how, sir shared, one of the participants
mm,
shared Devanukulam Nakshatra, by the end of
mm,
it,
mm,
the good
mm.
planet became the bad, or the bad became the good one. So I'm always
Correct.
forward to those unique concepts. And one more thing, sir, I want to thank you so much for being
Mm,
so patient with all our
mm,
questions. Sometimes in our excitement, I mean, not intentionally, sometimes unintentionally, just because we're excited to ask you a question. Sometimes we
mm.
interrupt. I'm really sorry for that. But thank you so much for being so patient and answering each and every question, even if we ask it 10 times. We're forever grateful for that, sir. No
No, that is
teacher shows
okay.
that much
See,
patience.
that is what now over a period of time we all have become like a family. We travel, I share whatever I got. That is only because we have, I mean, gelled like that. Now see, most of the times none of the students take me for serious. Many times I have even pulled Padma madam with ice cream, right? So she does like it's like somebody can take it very personally, right? She hardly even complains. So that means we are gelled like a family like that, right? So when you all are like this, so I think I don't even think one moment to give everything to you. Yes, 2 or 3 people are there. They rob, they sell, they do other things. But you all also know at the end of the day, it is totally useless for them because I am useful only because of my Guru's blessings. Otherwise, I will not be able to remember so many things and give predictions. How did I give 15, 20 personal predictions live in the class? It's only because of Guru's blessings only. That confidence I took as a platform to show Prashna as a superior. So like that, 48 people are there. So we are not bothered about 2 people. It's always because you all are like that. So it is an opportunity I am getting to gel with you all more nicely. So anyhow, thank you everyone. And hopefully, okay, I think Prasad sir has raised hand. Let me take that and then I wind up. So others, please
Yes.
bear. Okay. Yes,
Yeah,
Professor.
just one last bit, sir. Sir, before you joined the session, I had requested, this concept of family which you talked about. I requested everybody for something, and throughout the session today, that was maintained. I'm grateful to all my co-learners, and hats off. Thank you so much.
Okay, so something Sarah's requested and you all have followed. I'm very happy. So it will, I 100% know whatever Prasad sir as a, so he's an elder person who always guides us, including me. And if you all followed up, and definitely it would have been for the purpose of our class only. So thank you everyone on behalf of Prasad sir also. And
thank you, sir.
So have a great weekend. See you all on Monday. Good night.
Thank you so
Thank you,
much.
sir. Good night, sir.
Good night, everyone.
Thank you, sir.